back to Morning Coffee. I'm Jim Cuccinata. I am from Newell Health, and it must be time to talk about something health-related. Today I am with Mike Newell. He is the president of Lifespan Care Management. Welcome, Mike.
Thank you, Jim.
So we were talking off-set about some of your hobbies, which we'll get to later, but tell us about Lifespan and kind of how you got to starting a company.
Right. Well, Lifespan is what we call a care management organization, and more recently, people are talking about health advocacy.
Okay.
So what we do, our clients are patients, but generally the sons and daughters of the elderly.
Right.
Help or hire us to help navigate the healthcare system on behalf of their parents, because they see their parents beginning to lose function.
Sure.
They're concerned about it. Are they safe at home? Aging in place is a big one.
Right.
And we see patients in all settings. We see them in their home. We like to see them in their home.
Right.
But we see them in the hospital, in the nursing home, in the assisted living. We go to doctor's appointments and so on.
Right. So you act as a kind of a consultant or a liaison between the medical field and the regular consumer or patient's family to help them kind of age gracefully and kind of make sure they're getting the right care and going in the right place.
Right. So we're nurses. So yes, we are in the medical field. We do pay attention and drill down into all those aspects because it is complicated. But there's other complications that we help with. So Medicare, Medicaid, what are you entitled to? How can we leverage your benefits to help you? Do you qualify for other entitlements that you might not be aware of?
Okay.
Just navigating the whole social service system and so on.
Right. It's actually interesting. I was at a trade show, and the people next to us, they were insurance salespeople for nothing but Medicare. And they were telling me in the state of Arizona, a person who is newly into Medicare has over 148 options.
Yeah.
And the guy was saying, you can't know 148 options. He said, so what ends up happening is people end up bubbling up and picking 4 or 5, but I know what you guys do is actually go and say, these are the 4 or 5 that are right for you. You actually do that due diligence for them.
Right. So based on their health history and the natural course of whatever chronic diseases they may have, what are they going to need in terms of their benefit package is important.
Sure.
So we help with that.
Help with the supplemental as well as
the supplemental, as well as what Medicare is going to pay for. And we also do insurance appeals when people hit a wall in terms of what's covered and what's not covered.
Right. You mentioned you were a nurse. How did you get into the field, and then how did you kind of see this niche?
Well, I've been a nurse for over 40 years. I was in ICU and emergency for many years, and I went wherever they were going to teach me something new. So I worked in all the big shot hospitals downtown Philly at one time or another. Right.
Any shout outs for any of them?
Well, Jefferson was a big spot for me. Temple University Hospital emergency room was a big spot for me, and the neurosurgical ICU there.
Nice.
But again, almost all the hospitals at one time or another, because I did agency work as well.
Okay.
So a lot of Saturday nights, Sunday nights, that kind of thing.
Sure. So you were able to tell your wife, you're spending every Saturday night in the city. Unfortunately, it just wasn't with her.
Well, it was, there was good money in that at one time.
Right.
You have to raise a family and
so
on.
Absolutely.
But what it helped me do is assess people quickly, navigate through the chart quickly, find information that I needed, anticipate what might go wrong, and be ready for that. And kept going to school.
Sure. And
my master's is in nursing administration.
Okay.
And while I was doing my master's degree, got interested in this new thing called managed care, 1989. What's managed care? What does that mean?
And sounds like it could be a future managed care.
Well, and then case management as a component of that.
Okay.
So I got a job doing case management for what's called a private rehab company.
Okay.
And their customers were insurance companies. Workers' comp, auto, you could still buy $2 million personal injury protection coverage, PIP coverage.
Okay.
Long-term disability insurance. Major medical was still around, so people that were catastrophically ill or injured, we would get referrals. We would see the patients in the trauma unit, in the rehab hospital, and manage them, follow them as they went across the continuum of care, finally to go home.
Right.
And so they taught me the insurance piece, which is important.
Sure.
You need to know how insurance companies think if you want to get your benefits.
Right.
And that's what we're pretty good at.
Absolutely.
And then seeing patients across the continuum and producing documents that you could adjudicate a claim or go to court with.
Right.
That's what we did. So
Okay.
my model is that, except we're doing it for our clients, not for
Insurance companies, right. And case management, right, it's kind of impersonal because it's really looking kind of at papers versus people. And what you're doing is actually looking at people versus paper.
Right. So case management, that term was kind of taken over by the insurance companies and the hospitals because that was a hot term at the time. But what it really means is you're paying attention to one person.
Right.
And you're paying attention, what do they really need? What's the most appropriate care? And when I say appropriate, I mean what's most likely to work for this person.
Right.
Not what we usually do, whether it works or not.
Sure.
So that's
try taking them a little bit out of the mainstream and actually personalizing their care.
Correct. Yeah. You really need to know the person, what their value system is, what their goals are. You know, if they don't have the same goal as the physician or the health provider, then the treatment program is not going to work.
Not going to work, exactly. And you mentioned that you were a health advocate, is you know, kind of how you describe yourself now.
Right.
Explain a little bit about how, you know, how that works.
Well, just like you wouldn't go to court without an attorney because the judicial system is complicated.
Right.
You really don't want to have, you know, encounter the healthcare system without somebody that kind of knows how the system works.
Right.
And make sure it's going to work for you, not for the doctors, the hospital, the drug companies, and whatnot.
Right.
So we go to doctor's appointments, for example, and we know what the patient wants to ask and what needs to be resolved. But a lot of times, if you go into somebody's office and you take your clothes off and they start talking code words to you,
right,
you don't know what they're talking about. You're worried about what they're looking at.
Sure.
You know, you don't remember what they say often.
Right.
So
well, there's a lot of stress.
There's a lot of stress.
And I think that's one of the things that people need to remember is there's a lot of stress if you're just going in because you have a sore throat.
Right.
It's immense stress when you're going in, when they're going back to see if you have a cancer coming back, or as you're aging and you don't have as much maybe control over your memory as you'd like to have. And that's kind of where you step in to kind of ease that tension.
Right. So a lot of times we explain things to the doctor that he might not ask or the patient might not remember to tell.
Right.
And that can change everything.
Okay.
Also, you know, a lot of times the doctor, typically your primary care doctor, sees you for less than 8 minutes. Because if he doesn't see 8 patients an hour, he's losing money.
Right.
So when we're there, we tend to have more time with the doctor and make sure we're all on the same page. And that, for example, if he writes a script for a medication, does that medication conflict with what the patient is already on, and some other doctor ordered, and so on.
Right.
It's kind of important.
I'm here with Mike Newell. He is the president of Lifespan Care Management. We just spoke about how doctors typically are only seeing their patients for 8 minutes. Unfortunately, we need to go to a commercial break right now because we have to pay the bills. But when we come back, we'll talk a little bit deeper about what Mike does, who his patients are, and why you should care. We'll be right back.
Today's show is sponsored by Hargrove Demolition, your demolition experts. Hargrove is a family-owned and operated business right here in the southern New Jersey area, bringing you 45 years of demolition expertise. Hargrove has all your demolition needs, from emergency demolition service to demolition equipment rental. Hargrove is one of the state-approved recycling facilities right here in the southern New Jersey area. No job is too big or too small for Hargrove Demolition. Contact them today at one of their 3 locations.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been, the way it always should be, the way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to speedraceway.com or just get here now.
When we make Beyond Natural dry dog and cat foods, we start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at purinabeyond.com.
Extra Innings is the nation's premier indoor baseball and softball training center, featuring indoor batting cages, 7 multi-use tunnels, and training rooms. Extra Innings can provide professional instruction, private and group lessons, and the best year-round clinics. Along with a nationally recognized pro shop that features the latest and widest selection of equipment and apparel, our experienced staff can provide you with the right instruction and help you find the best equipment for your ability and budget. Extra Innings, where the game never ends.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
Welcome back to Morning Coffee. I'm Jim Cuccinata. I'm here with Mike Newell, president of Lifespan Care Management. When we first started talking, we talked a little bit about what a patient advocate is, talked about your company, kind of the things that you provide service-wise, and we also talked a little bit about your background. Mm-hmm. This segment, we want to talk a little bit more about kind of the what you do and who you do it with type stuff. So first thing I want to talk about is the term age in place.
Right.
Kind of what that means, who your client would be, when they should engage with you, and that type of stuff. So let's start with the easy part, right? What's age in place?
Right. Well, aging in place really means that you are in a place where you want to be, that you're safe there as you age, and that there's supports there to help you stay there with a good quality of life and be safe.
And obviously that could be a facility versus at home versus living with a caregiver.
Right. It could be a facility. A lot of elderly people think that assisted living is actually a nursing home.
Right.
It's more like being on a cruise.
Sure.
Okay. But it also costs like as if you were on a cruise. But you know, a lot of people that you try them out in there maybe for a respite stay, a short-term stay, to see how they like it, and after about 3 weeks you can't drag them out of there.
Right.
So there's a lot of misconceptions about you know, long-term care in an institutional setting.
Right.
And it's really about what's appropriate for that person and the culture of that, or you know, that community or organization.
Right. And the level of care that they need, obviously.
Correct. Yes.
And then we talk about who your patient is. Obviously, we kind of know who your patient is versus who your client, right? So your patient would be typically the elderly or people who are aging or need more help, right, going through the medical continuum. But your client a lot of times probably isn't the patient.
Right. Well, we call the patient our client, but generally it's the son or daughter of the elderly that's writing the check.
Right.
Because they don't know what to do. There's too many variables. They have their own job, their own family. They don't know what to do. Often they call us when there's a crisis.
Right.
You know, mom's fallen, now she's in the hospital, and they're going to ship her here or there, and we don't know what to do. We're not comfortable with the treatment plan.
Right.
And so we assess the situation and try to understand the functional limitations of the person, what their functional gains might be if, you know, a rehab situation was put in place.
Right.
And so we can direct them terms of a plan that's most likely going to work for them.
Great. And then how early in their aging life should people start contacting you?
Well, we would like to see them earlier because we think the payoff for them would be better. In
Right.
other words, once you've fallen and broken your hip, you know, that's difficult because many people lose function. Now they can't do stairs. Now they have to have a walker. Now they can't drive. Like, let's see you before that to put some things in place so that you're going to be safe.
Right. So would it be one of those things that before they sign up for Medicare for the first time, it would be a good time to talk to you guys for the first time, kind of, so you can start planning and putting it, a long-term plan together?
Well, if you have chronic diseases, you have heart disease, one or more chronic diseases, and for example, if we were talking about your mom, you notice that your mom is forgetting things. You notice that her mail is piling up. You notice that she's a little shaky when she tries to get out of the chair.
Right.
That would be the time.
Okay.
That we would do an assessment and really assess them for safety, assess the house for safety,
Right.
Assess their medication for safety and appropriateness.
Okay.
And also assess them for their cognition.
Sure.
So while you are talking the normal things that you would normally talk to her about, you might not see over time that she's beginning to lose her cognitive abilities.
Okay.
And we can identify that a little better and give you a heads up.
Right.
So that, number one, you at least put a plan in place to approach that, but also a plan in place to mitigate the decline in functionality.
Okay. And do you typically find that you deal with couples, or are you dealing with after a parent passes or a spouse passes? When do people typically come to you?
Or typically, the parent is living alone.
Okay.
But sometimes, in fact, I have a appointment tomorrow to do an assessment for an aging couple.
Okay.
The daughter is hiring me, who's a physician, and her sister is a dentist. Now but they're just, they just can't do it anymore.
Right.
Because their parent is resisting them.
Sure.
Or not listening to them. And the typical thing is, well, I changed your diapers, don't tell me what to do.
Right.
So our relationship with our parent is as if we were 7 and they were 35.
Right.
Even though they might be 85 and we're 55.
Right.
So we want to pay attention to that, and it takes the burden off of our client.
Right.
And we are able to say things to the elderly person who may have some cognitive issues. And when people start to lose their cognition and they don't know what to say when they get into a new situation, they say no.
Right.
Right? That's they're trying to maintain control.
Sure.
Okay, so if we can recognize that and find a strategy that's going to work for them,
right.
It takes the burden of care off of everyone, and it's also a lot less expensive down the road, because once there is this catastrophic injury, a fall, a head injury, then things start getting really expensive.
Right. Well, it's funny that you mentioned that a dentist and a doctor are hiring you for an assessment, because probably a lot of different reasons too, from a professional side, is they're really busy. They don't know. They may know how to treat a person, but they don't know how to maneuver the insurance companies and Medicare and even their own health system.
Right.
So that's very interesting. But in general, when you are working with a client, what is the reaction from the doctor?
Well, the doctors, when I first started this 12 years ago, they were like, I don't know, I never heard of this. They weren't too sure.
Right.
But most doctors are welcome,
because
then they know that they have a sense that the treatment plan is going to be followed.
Right.
Once they make a treatment plan, we're offering them information more quickly.
Right.
Than they would otherwise get. It's meaningful information, because we know what information the doctor really needs to make his decisions.
Right.
Often we bring up issues that they may not have thought of.
Right.
And they're kind of actually happy with that, because then that makes them look good because it's dealt with.
Yeah.
So
I would also imagine that in a lot of cases, you kind of find more billable instances for them kind of by mistake, because you're looking at the whole person and they're only looking at one specific part of that person.
Right. So they bill based on the complexity and the time they spend with the patient in terms of not only assessing different body parts, but counseling and teaching and so on. So yeah, it helps them in multiple ways, you know. But they really do want their patient to be successful,
Right.
And this helps them do that.
Absolutely, great. I'm here with Mike Newell. He is the president of Lifespan Care Management. We are going to take another break, pay some bills, and when we come back, Mike is going to tell you why you should be calling him today. We will be right back.
Sub some sizzle. This is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
Simply Gents, located in Marlton, New Jersey, takes care of all your grooming needs, including haircuts, straight razor shaves, massages, facials, manicures, pedicures, and waxing. To find more information or book an appointment, visit us online at www.simplygents.com. The secret weapon of a well-groomed man, Simply Gents.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to speedraceway.com or just get here now.
When it's time for Jersey Mike's to make a really great sub, this is what we do. It's what we've been doing. It's what we've always done. It's what we'll always do. So what are you doing? Jersey Mike's. Be a sub above.
Today's show was brought to you by Alicia Kelly of White Horse RV Center in Williamstown, New Jersey. Alicia is your RV expert. Contact Alicia at alicia@whitehorserv.com or give her a call at 856-262-1717, extension 203. When you think of RV, think Alicia Kelly.
Today's show has been sponsored by Farmers Insurance in Voorhees, New Jersey. To protect your assets and the people you love, call Mike Skoranek, your local Farmers Insurance agent, at 856-336-2553.
We are farmers. Bum, ba-dum, bum, 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 bum.
Welcome back to Morning Coffee. I'm Jim Cuccinata. I'm here today with Mike Newell from Lifespan Care Management. And we're talking about health advocacy. We're talking about how to help people age in place. And now we're going to talk a little bit about the qualifications that someone would need to become a health advocate, and why kind of your credentials and the people that work with you are kind of the creme de la creme of this industry.
Right. Well, there's a lot of people out there saying they do care management, case management. Some of them may be social workers. Some may have a gerontology degree or a psychology degree. Our model is nursing, but not just nursing, but what we call rehab nursing, which is, I'm not here to do it for you, I'm here to enable you to do it for yourself. So right. That's our basic philosophy. That being said, my care managers have to have a master's degree and or a bachelor's degree with subspecialty certification.
Okay.
And the certification is that you've worked in an area at least 2 years and you've passed the national test to show that you are an expert in that area. So the area could be neurosurgical nursing, rehab nursing, case management, medical case management, emergency room, intensive care. It doesn't matter. It shows that you're a professional.
Absolutely.
So our people need to be able to go in the hospital and be, conversant, get good information, assess the patient, go into the rehab facility, go into the nursing home, go into the doctor's office, go in people's homes, an assessment, and feel comfortable with that.
Right.
And negotiating between families, because a lot of times there's some mediation that is done between families because there's a lot of tension and anxiety over what's going on with mom. And, so our nurses tend to have 30 years plus or minus experience.
Right, so you're bringing seasoned people into the situation who probably also aren't afraid to ask for help from other colleagues, which is
well,
important.
we hope they're not afraid to ask for help, but, the nursing model is more of, I wanted to do what works for you.
Right.
Not, I'm tied to this model and we're going to try to do that whether it's working or not.
Right.
So that sometimes you see that with certain health providers. They don't want to hear about any other approaches. But we're going to use whatever tools work for you.
Good, that's awesome. And then one of the things that we were going to talk about was your hefty price. But I don't think it's a hefty price, right? It's let you explain.
Let's just say that we charge half of what an attorney would charge.
Okay.
But, it's about value.
Right.
It's really about what do you value, and, an assisted living costs around $8,000 a month. A nursing home costs in this region $12,000 a month. A live-in caregiver costs $250 a day.
Right.
So, our costs, if we can moderate that, keep you at home, keep you safe, is going to cost a lot less. So we do show a lot of value, we believe, but we can show more value if we see you earlier, rather than when you've had a treatment plan that's failed, and you're in a tough spot.
Right.
We can sometimes extricate you from that. But, it's a lot easier if we can see people earlier and anticipate what might go wrong and put some in place so that it doesn't.
Sure. And if you think about it, right, I mean, a lot of times people are talking about seeing their estate planner, talking to their financial planner, all of these types of things. It all costs money.
They all cost money.
And the value that you get from them, right, varies.
Correct.
And what nobody's really talking about is what to do and what the plan is. And you're coming in and you're saying, hey, don't forget that part, because that's the most important part. If you can't enjoy your money, and if you can't enjoy the quality of your life, then really, why are you paying all that money? Again, the lawyers and the financial planners are happy about it, but the actual patients and the clients are kind of left in the dark. You fill that gap, and you're right. If you're half as much as the attorney, you're giving them twice as much peace of mind.
Well, when you're doing a risk assessment, what are my risks of going bankrupt? Because most people that go bankrupt, it's because of medical expenses.
Right.
So what are my risks? If you apply for long-term care insurance and you don't pass underwriting, they say, we're not going to take the risk for you.
Right.
You should probably see us to have a plan B. Okay, so that we can assess that and sometimes argue with the insurance company is, no, this isn't so bad.
Right. You're looking at it this way.
We're looking at it different ways. Or even people that have long-term care insurance and they want to start to collect on that. We like to be there when they're assessed by their nurse or their assessment person, because that's a way we can advocate to make sure you get the coverage that you've paid for.
Right.
So we like to get our fingers in that.
Right.
And
so you mean you could pay for insurance and maybe not get the value?
Oh, absolutely.
I would be shocked to find that out.
Well, we do a fair amount of insurance appeals.
Right.
We had one recently where we had a patient that was in a long-term acute care hospital on a ventilator, and they wanted to send him to a nursing home. And the wife said, no, he's going to die if he goes there. We got a referral from an attorney. who said, "Can you help us out here?" And assessing, looking, he had Medicare coverage,
Okay.
but they wanted to send to a nursing home, and they wanted the wife to pay $17,000 a week to keep him there while the appeal was going on.
Oh, wow.
So the bill was $300,000 that the wife paid out of pocket to make sure he didn't
Yeah, right.
die, and we won. It was federal court, and then she got her $300,000 back.
Awesome.
And he is still being taken care of.
Great.
So, you know, we do have some big wins.
Sure.
At times, but you know, we try to see people earlier so that we don't have
get
to
to that part. Right.
get to that point.
If someone is younger and they're having issues with dealing with the insurance company, would they be a good client for
Right.
call?
Most of our, we cover the whole lifespan, but most of our, when we have kids, most of our children clients are the parents who have been turned down by the insurance company for skilled care for their child that's catastrophically injured or ill, is
Right.
getting skilled care at home and so on.
Mm-hmm.
And also people that, you know, they have they're adults and they have a critical diagnosis and the insurance company doesn't want to pay.
Right.
We look at their master policy,
Mm-hmm.
look at the care that they're getting, look at the documentation by the providers, and we can tell whether the insurance appeal is going to fly or not.
Right.
And 9 times out of 10 it will fly, but you have to go all the way to the end. So you get denied, and you get denied again. The third time you go to an independent arbiter.
Right.
It could be an administrative law judge or an independent peer review organization, and that's where we win, because the insurance companies don't actually follow their own rules.
Okay.
So you have to follow the rules if you're going to win those. You have to go all the way to the end. You have to know what you're doing.
Right, and you need to be persistent because
Correct.
you know
Yeah.
it's a maze to get through an insurance
Yeah.
company.
Yeah.
With the increase of kids with autism, do you see that type of kind of business growing for you? People coming earlier with kind of, it's the opposite end of the parent not making, or the parent making sure that the child has care through the rest of their life.
We don't actually market to that segment.
Mm-hmm.
That being said, that is a complex diagnosis,
Mm-hmm.
which autism is actually a syndrome, meaning it's a collection of symptoms that need to be sorted out.
Okay.
And so we can help sort out those symptoms, because a lot of treatment plans focus on the symptoms rather than the underlying cause.
Okay.
So we like to really understand what is the underlying cause and what other things can mitigate those symptoms rather than just kind of masking it with medication. So let's pay attention to diet. Let's
Mm-hmm.
pay attention to sleep.
Right.
Let's pay attention to having a routine that the child knows what's going to happen.
Sure.
And those kinds of things, and that can a lot of times moderate the symptoms, and we can also help find providers that are more likely to work,
With them and
with
through
that. Yeah.
Excellent. So we have a tradition here on my little medical show that you're going to look into camera 3 here.
Okay.
You're going to say whatever you like. Hopefully it's who you are, what your company does, how they can contact you, what type of patient you're looking for, and most importantly, kind of your value statement. And I sit here quietly and let you do your thing.
Okay, so how long do I get?
You get as long as you like. Usually
Okay.
you'll find after about 90 seconds you'll be, waiting for me to come in and save you. So go ahead.
So go now?
Yep.
Okay. Hello, my name is Mike Newell. I'm president of Lifespan Care Management. We're a 12-year-old organization that has been helping families navigate the healthcare system in the South Jersey, Delaware Valley area. We hail from Haddonfield, New Jersey, and travel to the shore, travel to western Foley suburbs in Delaware. I have other nurses that work for me that have different areas of expertise, but my area is catastrophic injury and illness and dementia. What we do is help people navigate the healthcare system so that they are getting the best care at the right price, and also support that family that is attempting to take care of that person. So our ideal customer is the son or daughter of the elderly. Usually it's a woman who is the caregiver in the family, and we're there not only to take care of her mom or dad or loved one, but to take care of her, to make sure that she's okay, that she's making the right decisions, that she feels supported, that she has the right information to make those decisions. So we're there to help the whole family, and sometimes we are there to manage expectations about what can really be done. But we make referrals to hands-on providers. We don't take any, we don't fee split or anything like that with them, and we quality control that provider's service. So if people aren't getting the right service, they don't feel comfortable with the service that they're getting, they don't have to argue with the service provider, the home care agency, the doctor, the nursing home, or whatever. We will do that on their behalf, and glad to do it, because we want to make sure that our clients get the best care. So we charge more than other care managers, but we feel that our value is enhanced because you could take our documentation and use it to adjudicate a claim or go to court with it. We do some chart review and expert witness testimony for malpractice and personal injury attorneys. It's not something that we go around looking for, but they do find us because we know how the insurance companies think, and we know what is important in terms of determining whether the standard of care is met, and failure of the standard of care leads to the client getting hurt. So we are feel very comfortable in that domain.
How can they reach you?
Oh, well, we're on the internet. lifespancm.com is our handle, or Care Managers New Jersey NJ.com. And if you go on our website, you can download an 18-page paper that will explain a lot about the healthcare system, the long-term care system. What are some red flags if your parents are showing that you need to pay attention to, so that they don't lose more function. So that's a freebie. All you have to do is sign up for it. And a lot of attorneys and financial advisors and other trusted advisors do refer to us, and we work with them to help with risk management, and what kind of money needs to be spent, and how we can best spend the money, resources, and if you run out of money, how you can apply for Medicaid or other entitlements.
Great. I'm Jim Cuccinata. I was here with Mike Newell. We had a great half hour. I hope you can come back and join us again. And after this break, we'll be coming back with Mark Cook and more morning coffee.